Welcome to JRTV. Now we can discuss about dental flossing. Flossing means the cleansing of interdental spaces by using different flossing, dental flossing instruments is known as dental flossing, because some people will have interdental spaces. While taking breakfast, lunch and dinner, there will be food impaction in between the interdental spaces, and it will leads to halitosis, bad breath from the oral cavity. In sometimes if a patient used to take fibrous food, there will be like chicken or mutton or husky food, also fibrous food also will enter into interdental spaces, get it and it will impacted or it will be struck in between the interdental spaces, leads to halitosis from the oral cavity. So in these cases the dentist will give self flossing or cleansing threads, because highly sophisticated this self cleansing dental cleansing agents will help in removing this fibrous food in between the interdental spaces in molars and premolars, in between the premolars, in between the molars, in between the incisors of maxilla, and in between the lower incisors of mandible will be removed by easy dental flossing. So the dental flossing will be advisable those patients having interdental spaces in upper anterior segment or lower anterior segment, or in between the in between the molars, because some patients want to replace but the removal of caries teeth. So there will be a space between the interdental spaces, particularly because lot of pounding pressure we will apply in the rear teeth, that is molar segment. So if there is any first molar is deteriorated badly, if the dentist remove the decayed teeth, if it is not replaced by artificial prosthesis, then there will be migration of second molar towards anterior side, and the third molars towards this there will be drifting of molars on forward movement. So there will be space between the molars and even premolars, like that. So immediately after removal of teeth, after 1 month, every patient should replace the abutment with dental processes. So there won't be any food impaction in between the molar teeth or premolar teeth, or in between the incisors, or lower incisors or upper quadrant of maxillary teeth and mandibular teeth, with chicken fibers or mutton fibers or fibrosis of any vegetarian food. Fibers of any vegetarian food may get impacted in between the interdental spaces, because some people will have diastema. Diastema means there will be gap between the two incisors or two central incisors is known as diastema, or in between the central incisor or and lateral incisor, the space between the two central incisors is known as diastema. The diastema can be defined as the space between the central incisors and lateral incisor. The space also we will consider it as diastema. So, sticky food or fibrous food or any sweetener, if there is any stagnation in between the proximal areas of these incisors, which will leads to halitosis of oral cavity, and there will be decomposition of there will be deterioration of enamel in between the incisors, which may leads to proximal caries. So the dental floss will help in cleaning of interdental spaces, either incisors of upper quadrant or incisors of lower quadrant, or the central incisor in between the lateral incisor, in between the lateral incisor and canine, and in between the premolars of mandibular left side or right side, in between the premolars of maxillary teeth on left side or right side, in between the molar interproximal areas of first molar, second molar or third molar of mandibular on left side or right side, and in between the mandibular proximal areas of maxillary molars proximal area, in between the first molar, second molar and third molar can be flossed with dental flossing. There will be thread-like dental flossing is available in medical stores. The dentist will suggest, according to your chronicity of halitosis or this food impaction in between the interdental spaces or in the diastema area will be flossen with dental flossing, like thread-like forward and backward movement of this thing. Vigorous and aggressive movement will cut the gingival tissue, and the patient will get bleeding gums in future. So, slowed study the dental flossing, the patient should use the dental flossings by this plastic handle dental flossings. So, this sticky food, even chocolates and choco bars and other sugar coated sweets also will those who stick onto dental surface or in between the diastema or proximity of interdental spaces will aggravate this dental caries or proximal caries or interdental caries in future. So we should floss the teeth with dental flossing available in dental depot, or dentist can suggest according to your severity of your problem. If you are having halitosis with this spacing, dentist will suggest mouthwashes, Hexidin, Listerine, Cavison and Colgate, and this betadine. According to dilution, patient should use after taking breakfast, after taking lunch, after taking dinner. Patient use it to gargle food, and patient should spit in the wash basin. And according to if the space in between the teeth is very minimal, patient will suggest dental flossing. This thread-like small tiny twisting will help in removal of this food impaction in between the proximity of neighboring teeth or interdental spaces. So the chicken fibers or mutton fibers or even these fruit debris can also remove very easily, and this sticky chocolate food and fibrous food will be removed by using this dental flossing by forward and backward movement of this interdental spaces. So dental flossing is suggestible. Those patients who have interdental spaces or interdental spaces, dental flossing available in dental depot, and that dentist will prescribe and suggest which dental floss is recommended for patients' severity of halitosis problem or food impaction problem or any problem which will be relieved by using this dental flossing. Thank you so much for watching JRTV. Please press bell button so that every update from JRTV will be updated to you. Please comment on uploading videos so that your comments are our best stimulations. Your comments are our best energizers. Your comments are our extra added supporting words to JRTV channel. Your comments are our extra added backbone to JRTV channel. Please share it in your big friend circle. Please share it in your big family circle. Please share it in your international clientele circle. Please share it in your big student circle so that every update from JRTV will be updated to them. Thank you so much for watching. JRTV is signing off.